So I can remind members to declare any interests. And for the formal meeting, there are no confidential items, which is 3. So can I just check with members? I think you should have all had the note earlier in the week that we were hoping to keep the length of this meeting to about an hour, which is a bit ambitious with the agenda, I think, and then have a workshop afterwards. So just checking people are aware of that. And I'm guessing probably people would still like to keep to that 2 hours and not go beyond 12. And therefore I do need to keep the meeting to the hour. Yeah, I'm getting nods to that. So what I'm going to suggest is, I think there are 3 items that are particularly important to cover. I'll take the Children's Safeguarding Annual Report first after the minutes, because that then means that the people who've come for that can then get off. Nick in particular.
Thank you.
Then the COVID-19 update. And then I'd like to pick up the engagement one, because I know I've seen some quite detailed comments on that from Helen and some of that's work that's going on. So if I prioritise those 3 and the other ones, which are mainly updates, then we'll cover as their time. Are people okay with that? Again, I'm getting nods, so I'll put that as a yes. So item 4 is minutes for the meeting held on the 11th of June. Can I check if anybody has any comments? I'm looking at, if people want to indicate, I'm looking at both the screen and the chat. I can, because I'm on a desktop, I can see the chat. So if people prefer to comment in the chat, but if people put hands up, I just can't quite see all of you on one screen. So we'll keep checking, but yeah. So I'm not seeing anybody with any comments on the minutes. Oh, Helen, yeah.
I sent a note through to Carol yesterday because there was something in the minutes about a development session, and it read as though it was a Health Watch development session, but actually it was our board development session. So I've sent a rewording of that through to Carol to change in the minutes.
Okay, thanks. So we're happy to pick that up and make that amendment. Okay, and with that, are we happy to agree the minutes? Okay, thanks very much, everybody. So I'll jump then to, sorry, I should say I haven't had notice of any questions. So I'll jump then straight to item 9, the Children's Safeguarding Annual Report. And Nick asked if you'd like to introduce this.
Yes, thank you. Can everyone hear me? Yeah, right, thank you. Okay, it's a little bit different from previously because my role's changed from being the chair, effectively one of the leaders of the group, to being a scrutineer. This followed government legislation, which I think you heard about last year. So we've been implementing that new legislation. So I'm now a step back and called an independent scrutineer. So unlike previous years, this isn't my report, it's the report of the 3 partners, the CCG, the local authority and the police. We've had a meeting with myself, with Julia Caldwell and those 3 partners to agree the report. So my role now is to write an analysis of the report, which I'm doing over August because my period in office ends at the end of August. So just whatever it is, 15 days to go on that. But I can commend the report to you. It's very comprehensive, very well written, covers all the issues we've looked at over the year. I'm really speaking for 18 months because the report covers 19, but it would be silly to imagine the last 7 or 8 months haven't existed. So I'm commenting on things that are more recent than the report. So it's very well written, very comprehensive. I can assure you as the scrutineer that Calderdale is in a very good position on safeguarding children. But as always with safeguarding children, there may be something around the corner, there may be something next week that's unforeseen and we've never thought of. It's an ever-changing landscape. Obviously, COVID is a challenge at the moment. The internet issues are always developing. The forms of exploitation of children are always changing. So whilst I can give you the reassurance that the organisations are working well together, that the Safeguarding Partnership is undertaking its scrutiny and development role very well, there's always just that safety warning that you know, that there are always unforeseen challenges in this field. But I can commend the report to you, and I'm willing to take any questions. I've got Julia here. Basically, I'm better on the strategy. Julia's got a closer eye on the details, so we can share any questions or challenges that we've got from you. Thank you very much.
Thanks very much, Nick. And I'm sure, so I don't forget later on, we'd all want to record our thanks to you for your period of, first of chairing the partnership, and then your role as the independent scrutineer, and for that support and help that you've given there. And also our thanks to Julia for the work we do. As you said, we're well aware of the detailed work that you do on this as well. So we make sure that's minuted and recorded. So I always think it's important, you know, obviously the role of the Health and Wellbeing Board, not to repeat everything that's in the detail, but to be assured that the right processes and the right structures are in place to guarantee, you know, as far as able on safeguarding. I think you covered that in your introduction. I suppose two brief things for me just might be useful for other people to know. I suppose firstly would be with the new arrangement specifically, well, it might be helpful just to explain very quickly how serious case reviews work and are reported in the new structure. And secondly, if there's anything specific you'd want to flag up in the context of COVID that perhaps we need to be aware of in the months going ahead. And I'm not sure whether that's to yourself, Nick, or to Julia, or whether...
Shall I start, Julia, and then hand over to you? Yeah, Julia and the staff are very much involved in the serious case reviews. One of the things that's changed is the now called child safeguarding practice reviews. I think it's actually improved. We have to do what's called a rapid review of the situation. We report that in to central government for their views to the panel that they've set up there. And then we suggest if there's a need for a full review on the back of that. And the governments have now undertaken 2 national reviews. The first one was on gangs, for example, where it's clearly a national issue rather than, say, a Calderdale issue or wherever. So that's working very well. One thing I'm impressed with, in particular in Calderdale, is there's a clear learning loop from serious case reviews. It's pointless doing them if they're just gathering dust. So there's a very tight process. And we had one last year that I attended. I think it was the first thing I did as scrutineer. In the high-profile child sexual exploitation case, we had the one where the young woman's written a book about it, which you're probably all aware of. And we got the professionals in that have been involved with that. And there really was learning. The school, for example, had changed their systems completely of alerting concerns. One thing I noticed that was really good, and you shouldn't take for granted, more or less all the staff that were in place working with that child were still in place now. And that's really important for learning and continuity. And in some authorities, they're really struggling with change and, you know, staff turnover and lots of agency staff. So that was very impressive. So we'll do that with the other, well, we've still got some serious case reviews ongoing. The problem with them, the government is sometimes critical because not us, but nationally, they get published quite late after the event. But it's usually to do, well, it's always to do with court hearings. You can't publish them. Say there's a parent on trial, you can't publish them in the middle of the criminal proceedings. So you also have to wait till the end. So we do have some that are pending proceedings. But Julia and her staff are involved in the detail. And I know Julia's working cross-border on some, so it would be useful to hear from Julia on those. Julia?
Yeah, for those 2 cases in particular, even though we haven't published, we've managed to get the learning out. So we've held a couple of learning events, and Nick's quite right. One of them is shared with Bradford. It's a case of a family that moved over here and were not in Calderdale for a very long time. And as I say, the learning from that has gone out anonymously. It's not under the name of which the serious case review will be published. But that learning has gone out. It's influenced policy and procedures, and it's embedded in the training. So those are 2 serious case reviews that are imminently due to be published once the criminal proceedings are concluded. On the ground, the difference, Tim, between the serious case reviews and the child safeguarding practice reviews is, as Nick's described, we've got a rapid review process, which is slightly different. But other than that, we will still carry on, and we're still trying to just get the learning from practice, from system-wide issues in Calderdale. So that will still continue. What we've found is that we've obviously have a shared secretariat with the Safeguarding Adult Board, and we try to bring together the learning from the SARS, which is the Safeguarding Adults Reviews, and the Serious Case Reviews or Child Safeguarding Practice Reviews. We're also undertaking now the Domestic Homicide Reviews. So instead of there being separate learning around the council, we're trying to bring that all together and do it once rather than do it piecemeal. So it's been really successful with adults and children bringing that together. And out of that, for instance, we've got shared priorities for transition and others. And we're expecting that with bringing domestic homicide reviews under us as well, that will have even more greater impact on the wider workforce in Calderdale. Did you want to go on to COVID now? Nick, do you want to say something first, or shall I go on to COVID related issues?
You start and then I'll tidy up if need be. Thank you.
Yeah, obviously it's massively impacted. So when we write these annual reports, or this is called a 12-month report, it's not just written to put on a shelf somewhere as a kind of ta-da. We write these reports to influence our business plans going forward. So obviously everything that's in here is findings and learning from Calderdale, from local practice that we need to improve, or we need to celebrate as good practice, or that needs to find our way into our business plan to find out more about the things that are happening. Obviously, with regards to COVID, we have now, it's really impacted on our business planning processes, and we have a section within the business plan which is solely COVID related, and you can imagine the things that are in there, like obviously our training program in the past has been extremely successful. You know, lots and lots of face-to-face training is given on a multi-agency basis in the past. Obviously that's all stopped since COVID. We have started virtual online training. The e-learning has obviously risen dramatically, but we need to find a new way of finding out what the learning needs are, and how we're going to deliver those in this new way of working. So that's just one element in this new COVID business plan, as you can imagine, that we're trying to grapple with and determine how we work going forward. We have, so that whole section within the Children Safeguarding Partnership business plan is replicated within the adults. So actually the pretty much word for word exactly the same about how we're going to monitor the impact of COVID, look at performance management, how we're going to audit, how we're going to train, all of those different things in this period, you know, looking like we're not going to return to normal anytime soon. Thanks, Julia.
Okay, any questions or comments from others? Oh, sorry. Yeah, Megan, you need to come off mute if you're trying to come in. Sorry, you're on mute. Yeah. Yeah, you press the screen, then it comes up at the top, I think. Oh.
Again, sorry,
it
came out down below, which it doesn't normally. Can I ask, with the new board, and I've missed a number of meetings, so I apologise. With the new board, is it still exactly the same people who are doing it from the Health and Wellbeing Board, or is there a separate group of people looking at the children's section? How's it working?
It's the same people, I think, isn't it? But yeah, Nick, can you just explain who's involved from council perspective?
Yeah, it's now called the partnership. So there's the three key partners. So in terms of personnel, it's been Julie Jenkins from the local authority, Penny Woodhead from the CCG. We had Sarah Baker, who from the police, who was on maternity leave, was replaced by AD War. So they're the three key partners. I've still been chairing it, but the chairing will be taken over by the partners from the end of August. Julia's in attendance to service the meeting. And then we've got representatives from public health and from our various subgroups that we work with. We weren't strictly, we only needed the 3 people, but we were worried that it wasn't quite still representative because we wanted the schools and voluntary sector on the executive. And then we've got the subgroups more or less as before, because we wanted to keep the engagement across Calderdale. So it's working. We've had a few hiccups, you know, it was brand new. So probably in retrospect, it wasn't best for me to chair it, but we live and learn as we go along. So I will be handing that over to the 3 partners. I think they're going to rotate on that. And in terms of linking the two, COVID and the working, I think as a lot of us have found, if you'd asked me a year ago, I would have said, how can you do it all online? It's impossible. But in many ways, it's worked better because, you know, people aren't commuting. The attendance has probably been better. People do seem to engage with it. So I'm sure you've all had a similar experience. Apart from the odd technological hitch, it has worked pretty well. But again, Julia's aware, particularly of the subgroup work, more than I am. Julia?
Yeah, so Megan, the subgroup, as Nick said, the subgroup membership remains that broad multi-agency wider partnership membership, and with regards to our communication and engagement, that still is with the wider partnership. The difference is, instead of that very large board meeting, with a much smaller partnership meeting with the 3 key partners, a few representatives from the voluntary sector, education, public health. So yeah, yes is the answer to that, very simply, Megan.
The one thing we're missing, we've more or less had an annual away day, and there might have been perhaps 40, 50 people at that, and we would have had one, but obviously we can't do that during COVID, and that's one thing that wouldn't work on Zoom. But I hope as soon as, if COVID leaves us, I'm sure that Julia will make sure an away day is held, because it's a good way of being creative and hearing everyone's voices. Thank you, Councillor Swift. Thank you.
Thank you.
We're trying as well. I think Helen Hunter will attest to this, but obviously a lot of our, communication engagement is with the stakeholders, with children, young people, families, parents, and community. Which obviously in this situation again, the business plan is saying, how on earth are we going to do that? So Safeguarding Week we've just held, as you all know, it was online. It was very successful with web-based hits, but obviously that only reached a certain percentage of our population. So we'll be looking at that in a lot greater detail about how exactly we engage with the public.
Okay, so I'm not seeing anybody else indicating. So can we receive and agree that, and record our thanks to Nick and Julia, Nick in particular for the work on this. So everybody agree with that?
Thank you, and
okay.
all the best in the future. Thank you.
Thanks very much, Nick. Thank you.
Thanks all. Thanks.
Okay, so I'm now going to take us back to item 6, which is the COVID update. So I think probably this sort of falls within 2 hours. I think if I ask Debs to start off and say a little bit about where we are with outbreak control and test and trace, and then perhaps broaden it out a little bit to talk about sort of preparations for winter. But Debs, if I can invite you to start.
Yeah, okay. Chair. What I thought I'd do is just give you a brief update of the current situation in the borough in relation to COVID, and then a little bit about the action that we're taking to bring the infection rate down. So as members of the board will be aware, the overall trend in infections in the borough continues to rise, and since lockdown was eased, the rate in Calderdale has quadrupled. So we're just around 40 cases per 100,000 at the moment. We were around 10 when the lockdown eased. We are testing an enormous number of people now. We've actually doubled the number of people tested in the last 2 weeks. And at the moment, just under 4% of Calderdale residents that are testing positive, and that's within the last 2 weeks. We've got some areas of the borough where we've got high levels of testing, and they're the areas we would, in the main, want them to be the high areas of testing. In the last week, so there's always a little bit of a delay, Chair, with the data on cases, but between the 3rd of August and the 9th of August, there were 91 cases in the borough, and we would normally expect, based on our previous trends, we would expect to get around 8 cases a day, and on 4 of the days in that period, we had more than 13 cases, and in fact on one day we had 27 cases. I'm giving you these numbers because I want you to understand how serious this situation is and how high the number of cases within the borough are. We're also seeing a different trend than we saw in April. So what we're seeing is cases in people of working age. And as you'll be aware, in April and May, we were seeing cases in older people. So the biggest increase we've had actually in the last few weeks have been in people aged between 20 and 29. And then second 30 and 39, so the lower half of working age people. And we do have information now that the government publishes around where in the borough our highest rates are, and although we have got cases of coronavirus right across the borough, the rates and numbers of cases are highest in parts of Halifax, just to the west of the town centre, associated with the more densely populated areas. I think what's important for board members to know is that there's no evidence at all that these higher rates are because people in Calderdale are any less likely to social distance than people in other parts of the country. In fact, we know the opposite was true, and that we know that during lockdown we had some of the lowest rates of infection in the country. We only have limited information about how and where people become infected at the moment. I will come on and talk to you a little bit briefly about what we're doing to help understand the situation better. But at the moment, we don't have a lot of information. But the information that we do have indicates that we're seeing COVID cases in people that are working in essential roles, and that in those roles they are more likely to come into contact with the virus, and since lockdown has eased they're even more likely to come into contact with the virus. And as members of the board will know, we're subject in Calderdale now, because of our exceptionally high rates, we are subject to local restrictions, and we're all having to make even more sacrifices to bring the infection rate down. And I think it's really important that partners in the Health and Wellbeing Board understand that we all have a role to play in bringing this infection rate down. And there's lots of reasons why this is important. For some of us, it'll be because we want to get our freedoms back so that we can visit family and friends outside our household. For others of us, it will be because we have got loved ones that are medically vulnerable to serious effects of COVID, and we want to ensure that their infection rate remains low to protect them as the shielding programme ends and as we prepare for winter. And others of us will be concerned about our children's education, and will recognise that if children are going to be able to return to school, we may need to all make other sacrifices to allow that. So I'm just going to say a little bit, very briefly, if that's okay, Chair, about the work that partners in the borough are doing to bring the infection rate down to the national average. So we are working hard together to prevent cases and outbreaks, and we're doing that by getting clear and consistent messages out to the public, including about how serious the situation in Calderdale is. We're engaging with communities, and particularly right across the borough, but particularly in areas of high incidence. And we're also supporting businesses and employers implement COVID secure working practices to keep their employees and customers safe. And the second thing we're doing is we're identifying COVID-19 cases quickly. And I've already said that we're doing that by massively increasing the amount of testing undertaken in the borough. But we're also improving access to testing for residents to make it easier for them to get tested. And we're also using intelligence to target testing at people in high-risk areas, in high-risk settings, or in high-risk occupations, even if they don't have symptoms. And then finally, we're working really hard to reduce transmission of the virus by delivering local contact tracing to enhance the national test and trace service. So that will, subject to a meeting with the government tomorrow, subject to their approval, that will be launched tomorrow, that service, and it will allow us to contact more people than the national service is able to do, because of our local knowledge of our communities and working with trusted partners in voluntary and community organisations, primary care, etc. We're also providing support to people to enable them to self-isolate. So if they're asked to, they're a case or they've been in touch with somebody who's got the virus, it's really important that they self-isolate, but some people need support to do that. And then finally, we're working hard with our colleagues in the police to enforce the coronavirus restrictions. And what I'm asking members of the Health and Wellbeing Board to do is to think about how you can help us achieve those objectives that I've just listed. These are tried and tested ways of bringing infection rates down, both tried and tested throughout the history of public health, but also tried and tested in some areas of the country where they have successfully brought the coronavirus rate down. And I'll stop there, Chair.
Thanks very much, Debs. Are there any questions or comments on what Deb said so far? Yeah, Tim, yeah.
Yeah, it was just a quick question, Debs. I heard about the local initiative in terms of local track and trace, and I was led to believe at a discussion yesterday at the sort of ICS DIPSI meeting that this was going to be the sort of arrangement was that if the national system wasn't successful in achieving a contact within the first 48 hours, then it would be passed across to the local service. Is that a fact, or is that just something that was being considered?
Yeah, that's absolutely right, Tim. So what will happen is, in particular areas of the borough, we're going to start with particular areas of the borough where we know we've got higher levels of infection. What will happen is that if the National Test and Trace Service isn't able to reach someone in 48 hours, those details will be passed through to us, and that button, hopefully subject, as I said, to the meeting tomorrow with government, the button will be pressed to allow that to start happening tomorrow. And then what will happen is we've got a team of 25 trained contact tracers from across voluntary organisations, volunteers, as well as paid staff across partner organisations. And what they will do is they'll make contact very quickly with the person. They'll text them first of all. If they don't manage to get through to them by text, they will ring them, and ultimately if they don't manage to get them over the phone, they will go knock on the door and actually visit them at the home. So that's how the system will work, and we know that that's worked very successfully at reaching a much greater proportion of people in other parts of the country.
And when you get the opportunity for additional home-based testing kits or testing people, you know, when you're sort of visiting, etc., as part of the track and trace, is that something that's available from the central government offer?
So that's something that we're exploring. We see there's a number of elements that'll enhance this even further. So one of them is around door-to-door testing, which we can give to the contact tracers who are visiting. Another element is making sure that we've got support, as I said, for people to isolate. The other thing we'll be able to do is we'll be able to keep in touch with people throughout the 14-day isolation period to see if they're managing okay and if they need any support. And we'll also be able to find out a little bit more about maybe how they think they might have got the virus, because at the moment the National Service has very little information about where the transmission might have occurred. So it will give us quite a lot of local intelligence that will help us inform our prevention activity, as well as the bringing the infections and you know, reducing transmission.
Because I was just thinking about the benefits of sort of reinforcing the every contact counts message that we've been using across the health and social care system, and you know, the broader health and social care community offer to support just what you've described in terms of when they are visiting areas, or be able to be tied in, if you like, into any of those initiatives. I know we've got the contacts there, but it's important, isn't it, to exploit that wherever we can.
Thanks, Tim. Not seeing any more. Should we move on a little bit to the winter preparedness? And I'm not quite sure who's leading off on this. I noticed, Robin, you've come off mute. Is that a volunteering to lead off?
No, I've actually raised my hand, Chair. I don't know.
Oh, sorry, missed you. Yeah,
that's all right.
Carry on.
I raised my hand. Just wanted to add a couple of things to what Debs has said as our Director of Public Health. Just to reflect huge thanks to all of you on the call. This has been an incredible effort to manage the impact of both the ongoing challenges around COVID and the additional restrictions that were placed upon us, and reasons for which we do understand, and we are working with government on that. And we clearly want to get to the position where we can remove those requirements, but the need to kind of reduce cross-household contact and also manage the safety of our premises of all types is essential to manage the infection rate. And I think you'll see from the national media how quickly this can escalate in areas that face challenges. And Leicester was clearly the first example, but I don't think it will be the last of what can happen if that isn't managed. And if the infection does reach a rate where there are further restrictions required. Just a couple of points of information that we do have a quite established rhythm now, where there is a Chief Medical Officer meeting on Wednesdays, and then the National Goals, which is happening around sort of now with the Secretary of State, and where the current restrictions are considered. And we will have further updates on that this week. But the formal regulations expire on the 19th of August. So we will have a formal review from government on that date. Just thank you so much to the voluntary community sector, and I think Topeka and Helen are here representing communities. We can't do this as a council or as public agencies, statutory agencies alone. The collaboration of communities, both clearly responding to the issues around Eid very rapidly, but also just the ways in which communities are supporting us in Halifax, but across the whole borough, has been magnificent. I have to say, I mean, the work rate of Deborah herself and her team, I know that many of you have been through the acute first phase, and particularly when that kind of got into the level of intense hospital admissions. Just for the local authority, the pace hasn't stopped actually at all. People are still working at the same pace today as they have been now for really getting on for 4 to 5 months. And just some thanks to Dickie and police colleagues. We have talked about the restrictions that come from the centre, but actually it's the engagement, education, the informing, and if necessary, and we hope it isn't, but if necessary, enforcement, proportionate, but we will use, and just say we are one of the few authorities leading the use of regulations to tackle areas that actually are not abiding by the requirements, and we will take action, and we will make use of the powers available to us. And we have been publicising that, and there's been a number of warning notices to licensed premises, but there are also other premises, other events. We will take action to protect the safety of and health of our communities. And thanks to Dickie and his colleagues for walking alongside us on that, because ultimately the public health and the well-being of our people is our priority. So just a big thank you. We ain't through it yet, but I think we can get through this through the way we work together.
Thank you. Helen, I think you wanted to come in.
I think I wanted to just reflect something back that we're hearing more and more of, that I'm sure is of no surprise to anybody, but that I would say so at the moment, I think we're asking people to do something that they don't want to do in order to protect themselves. And because there are different initiatives and different messages that are that are out there, people perhaps are pushing back and challenging more. So for example, I spoke to somebody this week who wanted to go and see their mum, and he was like, I'm not allowed to go and see my mum, but I am allowed to go and sit in a pub and use a toilet that 30 strangers have used before I might have used it, and how confusing that can feel for people who fundamentally were saying there's something that's in your best interest and in the best interest of the rest of the population to keep doing, when actually what you really want to do is go and spend some time with your family. And I think there's some subtlety in what we need to say to people to encourage them, because I can understand why when you see those two sets of rules you think, why am I allowed to do this but I'm not allowed to do that? And I think we need to be really cleverly conveying what outcome we are wanting and why we're asking people to do things, not just the rules and expectations, because I think that we lose people some of the time because they don't understand. And it's great to hear about the stuff that's happening in the community, because I think that gives an opportunity to provide that depth of explanation, which we don't necessarily get with some of the national messaging or some of the stuff that goes out kind of social media and in the press, that sort of thing. But I think it's important that that's actually quite a big part of the dialogue that people have at the moment.
Thanks, Helen. I know it's something reflected on very generally, and some of the national messaging really does quite conflict with what we're trying to say locally, frankly, as well. And I think, you know, the important message all the time is that we're not talking about getting back to normal. We're talking about finding ways of living with this for an unpredictable but significant length of time. I don't know, Debs, if there's anything you want to add on to what Helen said.
I mean, I think, you know, what that's coming loud and clear from the engagement we're doing, Helen, you know, that the messages feel confused. And I think one of the reasons I've just had to go at articulating the reasons in my little presentation, which are protecting people that are shielding, getting our freedoms back and enabling our children to go to school, is just starting for us to say the why rather than just the what. So I think it's a really helpful comment, and we're hearing that loud and clear. I think just on the what appears to be a big inconsistency around pubs and household visiting, I think one of the things that perhaps people don't understand or aren't as aware of, and why would they be, is that you know, every single establishment in the hospitality industry has to do a risk assessment to set out how they're going to protect the staff and the customers. And they are subject to being visited, and are in Calderdale regularly being visited by council officers who have a right of entry, can ask to see that risk assessment, can observe the practices, and can issue directions, and ultimately can close establishments down. That's obviously something we can't do in our own homes, in each individual home. So that's part of the rationale as to why pubs and restaurants can stay open, but we can't visit people in other households.
Thank you. I've got Councillor Evans and then Vicky Whitehead wants to come in. So Ashley.
Thanks, Chair. Just in response to Robin's reference to licensed premises, and also Deb's as well, we are getting a lot of concern from the public and publicans as well about how many licensed premises seem to be not acting in a COVID safe way, and there's a perception that nothing is really being done about it. I understand the desire not to prosecute people and so on, but I think there is a need to ensure that we are seen to be making licensed premises safe places, and we don't allow some of those to get away with flouting the recommendations to the expense of some of the other businesses who are doing it properly and safely. So I guess I would urge as much action on that as possible, really. Thank you.
Thanks. Dickie?
It's probably timely and helps with that point as well. So I can certainly reassure Councillor Evans that the local authority and their licensing powers and visits to these establishments are taking place. And they're, as Robin has said earlier, being wholeheartedly and firmly, robustly supported with police as well. And it's fair to say, I think, I won't go into naming and shaming at this moment in time, but it's not something that Robin and I are adverse to, and it's something that we're looking at with our legal teams in terms of our comms around that, because we think it's important that people understand that. But I can tell you some of those premises, I think they probably end up putting more staff on than they've got patrons coming in to actually deal with some of that as a consequence of our visits. So I'm really proud and pleased with the work that the local authority are doing, and I'm happy to get alongside and support that. I think the point of enforcement for us, the way I think was helpfully described when we had the national meeting, is that by the time we actually get to the enforcement, sadly, the damage and danger has occurred. And as was described on that national meeting, people didn't start wearing seatbelts because they feared they'd get a fine. They started wearing seatbelts because they knew the social unacceptability of not wearing seatbelts. They knew the danger and damage to their lives and others by not wearing that. And we know we're in that place and space, but I agree with you entirely that there is a proper place, and we are firmly right alongside the local authority where we have gone through the engagement, gone through the explain, gone through the encouragement, and tried to prevent everything we can. Where we have clear, flagrant and blatant disregards of COVID-19 restrictions and regulations that endangers the public health, we will use all the enforcement powers we have, and we will make sure that that's known. It's not just a toothless tiger, but the truth we all know, that fine isn't going to be the answer. So we're not going to enforce our way out of it, but nor will we shy away from that enforcement where we can and should use it. So hopefully a bit of reassurance. And that was indeed the point I wanted to make, Tim, so it covers off hopefully for Councillor Evans what he wanted to hear.
Thank you, Nicky. Robin, were you looking to come back in?
Just to add to that, to Councillor Evans' point, that if you have specific concerns around specific establishments, do encourage people to feed that into us. We are, and I would just say this isn't just about pubs and restaurants. We are in an enforcement process around 2 other sites that wouldn't be appropriate for me to name at the moment, but in an advanced stage enforcement of different locations where there has been some real issues. And I would say that we will act on, and in fact, it tends to be when we're getting information from the community, that's where we're able to act, because it tends to be well informed and it's clear and helpful to us. So, and I would just say that if anyone's saying that nothing's happening, just a reassurance, we had our teams are out till 3 a.m. on Friday into Saturday morning. They're out till 2 a.m. on Saturday night. Most of our premises are getting repeated visits, and I've heard people say, you know, that they're almost kind of, oh no, not another visit. So I think we are out there and very visible. And if there are any people raising concerns and worries about exception to that, then do let us know.
Okay, thank you. So the second element about preparations for winter, I'm aware of probably not having time to do this justice today. I don't know, Anna, are you in a position to say a little bit about issues from a trust perspective?
Yes, I can do that. Happy to do that. Just in overview, obviously number of inpatients in hospital is much reduced from previous levels, very low numbers. And in terms of the ask now for all hospital trusts and all parts of the NHS, is for us to try to optimise and increase the volume of non-COVID work that we can do. So for people who have been had their care delayed. So we're currently doing very detailed modelling work with all partners, with primary care, about how can we restart some of those services. And the ask is to really to be restarting them prior to winter. We have a national deadline to submit a system-wide plan for that by the 1st of September. I'm sure other colleagues will want to comment on that. Alongside that is about making sure that we're protecting capacity going into winter. Clearly, during the peak of the pandemic earlier this year, we worked through a number of plans about should there be a surge and an increase in volumes coming into hospital, about what the operational plans are to make sure that we can respond to that in terms of increasing our critical care capacity and our acute bed capacity and our deployment of staff. So we're in a state of preparedness, and for hopefully there won't be that surge in an increase in COVID numbers, but also around our preparedness for increased volumes through the winter period. Well, I have to say, but it's challenging that ask to return to pre-pandemic volumes of activity. And the approach that we're taking to that is to really push that as hard as we can to really understand what our ability to do that is, mindful of the impact on people who are waiting. But I have to say that we are quite cautious about that as well. The safety of our staff, our colleagues and patients comes first. So I'll pause there because I'm sure other partners will want to comment as well who are involved in some of that system-wide planning.
Yeah, thanks, Anna. I don't know whether Debbie or Neil want to say anything from a CCG perspective.
Yes, Chair. Debbie and I will probably do a bit of a double act. So as sort of Anna's alluded to, we're doing a lot of work on sort of the NHS reset. We've had a phase sort of 3 planning letter, which we're working towards submissions for September on. I suppose the other big area that we're doing in preparation for winter is flu. People have seen the significant rates of increases that are needed to be done. So we've got a working group. People may be aware the majority of the inoculations are done through either schools or through GPs. And we've got them on our working group along with the hospital sort of district nurses and public health teams. So we're just sort of working through some of sort of the risks, which one of the main one is availability, but there have been some sort of breakthroughs, particularly with, I need to get this right, a new flu vaccination, which doesn't include porcine, which will enable hopefully a better increase within the BAME community in certain targeted areas. So hopefully going to have a bit of a plan in place by September to be able to understand how we hit those targets, understand where we got gaps, and recognising it's almost a doubling of the flu vaccinations from last year, and how we're going to do that sort of as a system in partnership. I'm going to sort of hand over to sort of Debbie, who has been part of the A&E delivery board talking about winter preparedness.
Debbie.
Okay, thank you. So as Neil said, A&E delivery board across the Calderdale and Greater Huddersfield footprint leading a piece of work and signed off the winter action plan this Tuesday. It's probably worth noting that the chair of the A&E delivery board, and its name does not really reflect its role, but Ian Baines is now taking the chair of that A&E delivery board, and I think that signifies a real move to a much bigger focus on community as much as hospital. So there's 17 key actions being identified. It might be something the Health and Wellbeing Board want to be cited on. It's structured in 3 areas: keeping vulnerable people safe through winter, stepping up timely access to emergency, urgent or a rapid response, and then making sure that we're stepping people back down to home or into a transitional bed, and then that real loop back to keeping people safe and well at home. It's underpinned by a comms plan. The comms plan is being developed, the strategy by Magpie, who you'll be aware did work for West Yorkshire ICS on looking out for your neighbours. So the action plan is signed off, the actions will be progressing, and any delivery board will have oversight of the entirety of that delivery, and it may be something you want to see at Health and Wellbeing Board.
Thanks, Debbie. Yeah, I think it'd be useful both to see it as a future agenda item, but I mean, I think if for information people could be circulated like the 17 key actions, that would probably be really interested. Is there anybody else wants to add on this one? I'm just looking for comments. Not seeing anything in this case. So I think if we could timetable this for perhaps a significant item at where are we now, August, so it'll probably be the October meeting. Sorry, Neil, do you want to come back?
Yes, sorry, I just forgot something there. One of the things we're working on with primary care is the reintroduction of more face-to-face visits. So people will be aware general practice is very much operating a digital first, which has sort of some highs and lows to it. We're working with primary care by the end of August, hopefully to sort of have a plan. The planning letter required all sites to be utilised. We're probably in the same position as the hospital as to being able to operate as we did before and offer the same face-to-face would be extremely difficult. So we're working out what is a feasible, safe and viable proposition for all our sites and our practices. And hopefully we'll be able to start communicating that at the end of August, beginning of September, and hopefully recognise it will be a balance between digital and face-to-face, and there will be some form of prioritisation in this. This won't be going back to the original sitting in surgery for appointments. It will very much be telephone, video triage first and face-to-face where needed, but it will be seen more openly rather than sort of the red COVID sites that have been in operation at the moment.
Thank you. I do think in all of this, I mean, primary care will obviously be the main pressure point for members of the public, but in all of this, you know, again, as we talked about before, good comms about the reasons why these things are going to remain challenging is really, really important. I think, you know, there's been an element of people kind of accepting for a few months that things were different, but if the national messaging sounds like we're getting back to normal, then people will be quite challenging when they see that the reality is very different. And I just think that explaining some of the reasons why it is going to be so challenging going forward, why procedures will take longer, etc., etc. I think it's a really important part of taking people with us on that. I don't think I've got anybody else indicating that they want to come in, so I think this will be a good item for our October meeting to catch up. But I'm sure also in between there'll be things you want to that you'll be looking for partner support with, particularly around takeover flu vaccination as well, and obviously I assume that'll get communicated out as and when it's required. People okay if I move on then to I'd like to briefly on the engagement report if we've time. Mike, do you want to start this off now? I know, Helen, you've got some comments on this.
Yes, thank you, Chair. Just briefly to introduce it, you may remember, members, in the time when we met each other and shook hands and things like that, we had a workshop in February looking at engagement, and my colleague Alex Hunter wrote it up, and we were hoping to bring it to the June meeting, but it got squeezed out of the agenda. And unfortunately, Alex is on leave this week, so he's unable to be here. So what we wanted to make sure was we didn't lose the work that you did at that workshop. But I know that Helen Hunter in particular has got some points she wants to make. And given that we're limited for time, I just wondered if you'd be okay, Chair, if we move straight to Helen so she could get her questions or her points across before we move into the next stage of the meeting.
Yeah, please. I think it'll be helpful. Helen? Yeah.
Thank you. Well, there was a couple of things I wanted to kind of give just a little bit of an update on sort of progress that we're making around trying to pull together engagement on a place level. So in the meeting that we had earlier this year, Jill Dufton from the CCG talked about an involving people strategy for Calderdale, and we've been trying to kind of behind the scenes quietly move some of that stuff forward. So the ambition would be for us to have a kind of a strategic group at a place level with key people who do engagement in Calderdale coming together to look at what we're working on, when we're working on it, how we can link it together better, and then have a network of individuals and organisations that do pieces of engagement work with our communities. Now that network already exists. There's quite a big list of organisations that are already coming together, and actually that network helped to develop the piece of engagement work that's live at the moment, asking people about their experiences of health and care services during COVID-19. So that piece of work that Healthwatch is leading, but that was developed by that partnership of organisations, and actually that's coming to a close now. We're analysing the data at the moment, but that network of organisations have already worked together on that, and the idea is that we'll then have task and finish groups that sit underneath that network that are focusing on specific pieces of engagement work that need to be done with our communities. Some of those might be done by individual organisations, kind of with the partnership of organisations knowing about it, but where we need to work together, we have the opportunity to do so. So at the moment, I chair a COVID engagement subgroup under the Safer Communities workstream of the kind of programme of work that's going on. And we've just done a piece of work to map every piece of COVID related engagement that's taken place in Calderdale across this period. at the moment, there's 19 pieces of work listed on that mapping document, which I'm happy to share with the Health and Wellbeing Board. I've got 3 or 4 things to add on to there that I've heard about in the last couple of weeks. Because I think it's really important that we say that at this time, we can't do what we need to do if we don't talk to people and we don't get an understanding of what our communities think. And that actually there have been lots of opportunities for people to do that with different organisations that they work with. So hopefully that kind of gives us a bit of a catalyst for doing some more of that work together, with like a really good example of how we've done it during the COVID-19 period. I'm hoping that for the next Health and Wellbeing Board, we'll have an engagement report from the COVID engagement about health and care services that we could present, and that perhaps Jill and I could present the kind of progress towards that joint working, if people would be open to having that as an agenda item for the next meeting. So there's some stuff there which I think sort of sits underneath what the Health and Wellbeing Board was talking about wanting to do. We wanted to get a greater understanding of what the public's views were to influence the health and wellbeing strategy, influence how we were working. We wanted to make sure that people's views were being heard and captured more often in the meeting. I've got some specific ideas which I've shared in an email with Mike and Alex about how we might be able to encourage a greater variety of public questions, because I really like what we've done with the live Q&As. I mean, I was nervous as hell when I did the Q&A with Ian, about care, but it felt like a really good way of getting people just to pitch some questions to us, rather than it being that really formal sort of ask a question at the start of the meeting. It might just be a way for us to set the tone and the expectation and understanding of the public. So I think that there's some stuff potentially that we could do around that. But I think that's all that I wanted to say for now. I'm happy to share the notes that I've got on the action plan, but I'm really, really happy to help refine that.
Thanks very much, Helen. So I think I've seen that as well, but I don't think most members will have. So I think it would be really useful to share that. So I think probably the question is what the next stage is to pull together the Alex's paper, that work that you're doing, and also some of the wider discussion having in the council about Calderdale conversations. I don't have a single group that's kind of pulling all those things together. I'm kind of looking to you and Mike. Is it okay to just sort of pick that up and make sure we progress that outside of this meeting, and then have that more substantial report next time? Is there anyone got any comments on that? We're happy with that as a way forward.
Chair.
Oh, sorry. Yes. Yeah. Sorry, Megan. Yeah.
It's okay. I think one of the things I want to say, and I want everybody to be very clear, this is not a criticism of anything. It's the NHS doing the best they can, but can't do what is needed properly for patients. And after going through, admin, a nurse, and nurse practitioner, and all those to get to a doctor, if you're feeling ill, you also feel ratty when that happens, even though people know it's not the doctor's fault. But it's ever so long-winded to get through to people. I just wanted to say that so people realised.
Yeah, thanks. I think, Helen, you picked up some of that when we were talking at the GP group, wasn't it? Some of the tensions, yeah.
There's a lot of feedback about that kind of administrative experience in what we're hearing through the responses to our survey. So there'll certainly be a theme about that comes out through the engagement work that we've done.
Thank you.
Thanks.
Okay, so so we've got a way forward on that one. We're up to 11. So I can just say, Mike, do you just want to comment briefly on the other 2 items we've not had time to move on to, and perhaps how we can pick those up? I can't hear you, Mike.
Thank you, Chair. On the Calderdale Cares item, it was on the agenda, and putting it on the agenda led to some really useful and important discussions, I think, between Neil and Stephen Cleesby and Debs and Debbie Graham and me, which was about actually doing some work to look at how people have been stressing how important Calderdale Cares is in both recovery and taking lots of other things forward, but that we perhaps need to have a bit of work outside meetings, having agreed it quite a while ago now, to get a sort of a revised narrative and a revised focus on it. So that's why we're looking at doing some work in development session on that. And so in a sense that took over the item that we'd originally proposed for the agenda this morning. And I think it's a linked issue. The other item on the health and wellbeing strategy, and again in discussions about the agenda items with both Ian Baines and with Julie, it was that the performance measures we've got are really important, but they're, you know, things like life expectancy are relatively slow moving over a few months period, and what's important is the actions that we're taking. So we've put the dashboard on the agenda, so the dashboard is out there and people can see it. But I think we probably need to think a bit more about how we actually deal with those items in the Health and Wellbeing Board themselves. So in a sense, it's fortunate that we're running out of time, because I think that's become a bit of a different item. But that's how we intend, if everyone's happy, to pick up those two items. I don't know if Ian or I think Jill may be here for Julie want to comment on the last one.
Thanks. Jill or Ian, anything you want to add?
Thank you, Leader. I think the point I think we were of the conversation that both Julie and I were having with Mike was the bit about making sure that the indicators actually work from a community asset base, rather than I think what we've tended to fall to is a set of indicators, a suite of indicators that that work from a deficit model. And I think this gives an opportunity to kind of think through about how we see this as about a community asset approach and building up from that. So I think the time we've got before it's next to Health and Wellbeing will give us some time to look at that.
Okay, thank you. If people are okay with that proposed approach, I'm not seeing anyone wanting to come in. Then I think if we note the forward plan, that covers the agenda. So if I can thank everybody for the formal part of the meeting and close that, and I guess we need to turn off the live streaming at this point.